Good afternoon, everyone. Thanks for tuning in today. My name is Jeff. I am going to be running the show here today as the MC. We'll get started so we get enough time to go through all the information. So we're going to talk about secure mail for patient communication. Nowadays, it's particularly important. We get a lot of inquiries about virtual care or staying in touch with patients who can't come into the clinic, who might be in isolation, or even just protecting staff and clinicians from having extra contact. So we're going to have Rohit Joshi, our CEO and co-founder of BrightSquid, and Mark Ayer, Director of Customer Operations, talking about it. So Rohit is a lawyer. He's been working in this industry for over 20 years. So he's an expert in privacy compliance. We'll talk a little bit about that, but also clinical process workflows. And Mark's been working with clinics for almost as long, just helping them implement secure mail, how it gets used, how it works sort of in the field in real life with patients. So we'll be going through a lot of that. We've got a lot of background to sort of help with that. So if you have any questions as we go through, please, you can type them in your little, your go-to webinar box, and we'll address as many as we can towards the end. So let's dive in. We're going to talk about, nowadays, with COVID-19, unfortunately, there are people who are taking advantage of the situation for their own gain. So we do see a rise in scam emails, people trying to get people to click on things, download ransomware viruses, that sort of thing. So we'll show you what to look out for in that sense, and something you can help educate your patients about. We are reaching out to the patients on our systems to help them get educated about that as well. We'll talk about conferencing services. I think now with everybody trying to get virtual care set up, there's a lot of different options to look at, and we'll talk about what you should consider in that sense. And we'll look at what patients want to use, how they think about virtual care. We'll look at what a virtual care system looks like, what it's made out of. There's not just one solution that you can really use to manage all of your virtual care, so we'll talk about that. We have a number of upcoming webinars that will talk about this topic on an ongoing basis, and we'll show you what those are coming up, and then we'll get into the winners of the draw. So let's dive in now, and I'll turn it over to Rohit to talk about some scam emails that we're seeing.
Thanks, Jeff. And this is something that it's near and dear to my anger, I would say, where we've seen hackers and scammers try to take advantage of the fact that people are working in desperate conditions or more desperate conditions. So what we have seen and what we've been tracking now is a dramatic increase in cybercrime. And that relates to scam emails being sent to patients or individuals, scam emails being sent to the providers. We've known for a lot of time, and for those of you who have followed BrightSquid, we've known for a long time that clinics are a target for ransomware, because the quality of that data is so high that the cyber criminals can demand a strong and expensive ransom. So we've seen, maybe not surprisingly, I choose to think that it is surprising that people would take advantage of this in order to further their own means. I think the one of the headlines here that I don't see, but I saw yesterday, was there was a testing facility that actually got hit by ransomware and shut down that ability to do their testing. And so it was one of those tragic scenarios that you hope doesn't happen. So we have seen a rise in these. If you're interested, let us know. We've in the past done full half-hour sessions on how to detect, how to view these, how to detect them, and what to do with ransomware emails. But I'll leave it at that, Jeff. I mean, I think that there's a lot that we could talk about protecting a practice and making sure that you're not vulnerable to this type of attack. And I think we're going to spend some time talking about some of the other things that we're doing to protect the practices.
Yeah, and any of our past privacy webinars that we've done are on our website. If you just go to the About item on our navigation, you can see, you'll get to the privacy webinars, and that one is in there, so you can view that at any time.
Yeah.
So let's look at unsafe conferencing services.
I guess that's me. Thanks, Jeff. So So lately in the news, there's been a lot of information flying around about various different conferencing services and how they can help us stay connected during this COVID-19 crisis by, presenting the opportunity for virtual visits, face-to-face conversation through video chatting. Even the service that we're using right now through GoToWebinar is being discussed as an opportunity to stay connected. And all of those commercial tools are wonderful for these types of conversations that don't include patient health information. Protected health information, as we all know, is a valuable asset. As Rohit and Jeff just commented, it's a very much a target for the bad guys that they want to get their hands on it to use it for nefarious purposes. So when we're thinking about how we're going to stay connected with others during the duration of this crisis we're currently enduring, it's very important to remember that most commercial conferencing services that you're hearing about these days were never intended to be used for healthcare. A lot of the services offer a free version, and that's what we're hearing about in the news is these free tools that we could use to stay connected, which are great to talk to family and friends, but absolutely not appropriate for use in healthcare scenarios. Um, the biggest thing is that these commercial software or conferencing services don't include any kind of encryption or any sort of protection to ensure the data is kept safe and secure. So it's actually easily accessible to the bad guys to get access to that data that's flying around and potentially abuse it and misuse it and do whatever they may want to do. It's also important to remember that any service that you're going to be using, if it wasn't designed for healthcare, it just doesn't have the underlying technology or the underlying security built into it. I mentioned encryption, of course, as that's the most common consideration or the thing most discussed when we think about security and privacy. But actually, encryption is only a small part of being secure and compliant. There's a whole host of things, and depending on where you are, there's different legislations. In the United States, of course, there's HIPAA legislation. Here in Canada, where I am, we're covered under the various Health Information Act in each province, as well as PIPEDA laws and so on that are at a federal level. And encryption is an important part, don't get me wrong, but it's really only a small part of what it takes to maintain a compliant health-based conversation. So I guess what I'm saying is those consumer-based systems that weren't built with healthcare in mind should absolutely not be used for patient interactions. And then the last point that I'll make before I sort of turn this back over to Rohit and invite in his comments as well is that it's very important to remember that while we're in this crisis and while we're all struggling to keep up with our patients' needs, while we can't necessarily see them face to face, all of the regulations and legislations that I already mentioned are all very much still in effect. Um, we can't make the mistake that because we're in a desperate situation that we can throw the rules out the window. It's very important that we maintain security, privacy, and compliance because we're obligated to do so on behalf of our patients. Security and compliance with legislation is more than just a bureaucratic exercise. It's it's steps and procedures that we put in place for very specific purposes, and that purpose is to protect our patients. And so it would be a very bad idea to throw all that away while we're in a difficult situation. Now more than ever, as Rowan just mentioned, with the COVID-19 scams that are flying around right now more than ever, being safe, secure, and compliant is so very, very important. And then lastly, I want to draw your attention to that quote at the bottom of the page from one of our patient users here in Calgary. The secure mail service, if you've not used it before, it's much faster way to connect with your doctor. As patients, they find it very, very quick and easy to connect and communicate with their doctors in a way that really the patients are asking for in the first place. As a parent and a dad and a patient myself, I find it much easier to be able to communicate in the way that I want to, which is through my computer, through my iPhone, so I can connect with my doctor rather than having to go in for every little thing. If I can do it via email, it saves me time, it saves me driving, it just saves me a lot of stress. So it's a much faster and more convenient way to communicate in so many scenarios. Rohit, are you still with me?
I sure am. So, listen, let's be realistic. I think that what we've seen over the past couple of weeks is, especially for the physicians and the psychologists that are on our call, there is an immediacy. You have to deploy something, and we're not in a position to say you must do this or this or this. I will tell you though, here is the concern. The first is that if you're going through the work of establishing a new way of communicating to your patients, that in fact you'll likely want to do that after the crisis. So let's do it right, and let's make sure that you have managed the privacy concerns, because ultimately you are creating a threat for your patients by using systems that are not secure. And that's all I'll say, because we're trying to help the front lines deal with the crisis. And honestly, I'm in a number of discussions with physicians, psychologists, and others who are on the front lines that we get it, but now's the time to actually do it right, and take a little bit of extra time to do it properly so that it's an enduring way that you can communicate. But anyways, let's maybe move on to what patients want. Mark, I think maybe you can take this slide.
Yeah, sure thing. Thanks, Rod. So it's important to note, if I didn't make this clear already, is that we've been providing our secure mail service to medical professionals and their patients for a very long time now. We have about 80,000 patient users that are interacting with their doctors day in, day out. And so recently we just went and talked to them and asked them how they feel about secure mail and how they want to communicate. And these are the responses that we got back from them. The idea of security and compliance is very much part of the day-to-day activity and the thought processes around those of us that are within healthcare. But it's important to remember that patients or just regular people are thinking about it just as much. I think there's so much in the news these days about various data leaks and hacking events going on that just regular folks are thinking about about their healthcare information and their personal information all the time. And so, to my point, a vast number, 85% of patients believe it's very important that their healthcare providers protect their privacy. And I would wager a guess that the other 15% just haven't really given it much thought. I think we all very much want our patient data to be protected. Any information about me that is on the internet, I want to know that who I'm sharing it with is taking it seriously. And you can't be taking it seriously as a provider if you're using tools and systems that are demonstrably insecure. Most patients, again, 75% of patients are not comfortable using traditional email. Most of us know traditional old-fashioned email that, believe it or not, has been around for almost 35 years now. Traditional email was never designed with any kind of security and privacy in mind. It was built to be easy to use, which it is, and I use it every day, but it's not something that I would use to share health information or my credit card number or financial data, because we all know that traditional email was just not a secure system. It's open to all kinds of attacks. And despite encryption that may be built into some email systems, it doesn't create that full compliance that we need in order to communicate around healthcare. And of course, most patients want to be more involved in their care, above and beyond the current crisis that we're currently all dealing with. Patients want their information. I think it's a very old-fashioned methodology to consider that the patient data is the realm only for the doctors and the medical professionals. It's my information. I very much want to be involved in it. So I would like my doctors to be sharing with me, their notes, their comments, and follow-up information. I understand that when I take my son to the doctor and I sit there in the room while my doctor talks to me about, or my son's doctor talks to me about what happens and what needs to be done. It's embarrassing to admit that when I get home from the doctor, my wife says, "Okay, what happened at the doctor's office?" I can't remember all the details. So it's wonderful when the doctor can send me those instructions after the fact. So I've got a document that I can refer to that says your son needs this kind of treatment, take 3 of these twice a day, whatever the case may be. Having that sent to me through secure mail after an appointment is invaluable. And of course, sorry, go ahead, Rob.
No, just on that note, I think what we've seen in the past, even very close to home in Alberta here, there was a physician that wanted to share regularly with their patient and was emailing back and forth. And in order to do so, they received a consent from the patient that said, yeah, you can email me. And that's kind of the methodology, or that's kind of the approach that's been supported by various professional organizations as well. But here's the challenge with that. In that specific example, and this is before the crisis, before the COVID crisis, but in the last 12 months, that physician, by using Gmail and clicking on a wrong link, exposed the data of 7,000 of his patients to the hackers. That's where we get into a challenge, because we want to be more involved with our health. We have physicians and dentists and chiros and physios that want to involve their patients more in their health. But that's the problem, is because those professionals, if they're using standard communication methods like Gmail or Hotmail or something, they're unnecessarily exposing their patients to that level of threat. And so we're trying to find somewhere in the middle here where we can provide that level of functionality without exposing either the provider, a healthcare provider, or the patient to that level of threat, especially, because of what we're seeing in the crisis right now with the ransomware.
Yeah, I felt quite badly for that particular doctor, Road, because he was trying so hard to provide better service and better care for his patients, and unfortunately wound up, in a situation where he selected the wrong tool, either through just not having the right tools available or not knowing what was out there. And while he was trying to do the right thing, mistakes were made, and unfortunately things didn't work out as well as they could have.
Yeah, and Mark,
Yeah.
and you and I have talked about this before, right? And same with Jeff. I would say that most of our customers right now are well-meaning. Like we want to do the right thing in our practices. The problem is that if we're blind to it, or if we're believe that a consent will solve the problem, it actually doesn't. Consent doesn't mean that I can expose 7,000 of my patients to a hacker. But that's the consequence, and reasonably foreseeable consequence of using tools that are unsecure.
Right.
Which is a great sort of segue into looking at a virtual care system, right? I think like we've been talking a lot about, here are the tools that don't work. Here's the criteria you need to hold in place when you're looking at the different tools you need to use to be in virtual contact with your patients and other providers. So I want to look at why secure mail is an integral part of that system.
Yeah, so if we start with this and talk first about where does secure mail fit in, and I would say that the best way to characterize it is really as a virtual front desk. In secure mail, we have part of our product is called a shared inbox, and basically that acts as the front desk that is the catch-all for all of the requests coming from patients. It has all of the requests that are requiring some level of diligence before they're escalated to a professional. And so typically in the medical environment, we end up seeing people that are, or the dental or the chiro environment, we're seeing patients that want to make an appointment, change an appointment, a lost a requisition, need to get something done that doesn't involve seeing someone. So the virtual front desk really operates as that clearinghouse, so that not every message is escalated to the healthcare provider, very much like the current phone system is. And I think this is probably one of the biggest opportunities to streamline the practice, is by having a front desk that's able to do this virtually, particularly right now when many of the clinics are shut, or they're not seeing the type of they're not seeing patients walk in as often. Having a front desk manage that and only escalate those that need to get to the professional healthcare provider, I think this ends up being one of the key elements to making a practice more efficient and also safe. If we move on then to schedules, this is something that there's a reason. Listen, there's a reason we all use email, and that's because we can deal with things on their own time. We can send a message when it's convenient to us, and we expect that it'll be answered when it's convenient to the recipient. So we don't have to align a one-to-one kind of a video visit or a one-to-one phone visit. Even we can just do that, and both of those together increase the capacity. Right? We can now collect information about the patient prior to their coming to an office, coming to our clinic. We can ask them to fill out a form. We can find out, interrogate them about, how sick are they, and do they need to show up in person? Certainly broadly accessible in the sense that anybody with an email address can start using Secure Mail right away. So there's not a long setup process. They don't have to download something specifically. They don't have to establish anything new because it's available right on the web from a mobile device. It's available from a computer or desktop or whatever we have. The next item is the closed compliant network, and I have to tell you, this is what is one of the lines of defense for our product. No hacker will get into our product because it's a closed and compliant network, and so we have identity verified all of the healthcare providers that are on it, which allows communications from other healthcare providers in a very secure way. So if I, as a physician, want to send it to a physiotherapist or a specialist to another specialist, we have an opportunity to, because we've identity verified every single person on our network, it becomes very, very difficult to hack. And then more on just a generic basis, we have antivirus, anti-ransomware, anti-malware scans that we make sure that those who are on our system, when they're composing messages and sending them to other people on our system, that we go through enough diligence that we can confidently say that there's nothing that's been attached to one of these messages that's going to proliferate through our network. And so we've taken many extra steps to make sure that's the case. I'm just going to talk briefly about this. I'm looking at the time, and it would be great if we had a little bit of time for some questions. I think this is very much, I would say, what we're seeing in the medical practices that we're working in. I think the dental and the chiro and the psychology practices that we're also working in, I think they're much more used to email. I think the transition for them is really around starting to use a secure form to protect the patients and protect their own practices. I think for the medical clinics, at least in Canada, this is a kind of an interesting approach because this now allows you to do that triage that we talked about, where there's a lot of back and forth that we can take care of with Secure Mail. And when a phone consult or when a video consult is required, or whether an in-person visit's required, now when the patient comes, they're actually prepared for the appointment and can take the most advantage of the very short time in the very stressed systems that we have right now. And then finally, to follow up, we can also take care of that in Secure Mail, so as to free that healthcare provider to move on to the next appointment.
Great. So should we move on now, Rod? Or?
I think so. Yeah, I think so. Just from a timing perspective.
Yeah, totally. Yeah, and I think just on this chart, I think you can kind of look at any kind of workflow that's going to come through your clinic. You can add a fourth column here, which is in-person consult, and this kind of maps the process in your clinic, and you can decide how you're going to address different issues. Is that a Secure Mail thing? Is that a phone call? Is that video? Is that getting someone in to see them? So it's a really helpful kind of visualization to look at how things can be managed differently and where you can find efficiencies, because typically anywhere you're going to have phone, you're going to have a lot of back and forth. So Secure Mail helps cancel a lot of that out.
Yeah, so I'll take this one, Jeff. I mean, I talked about some of this in my a moment ago when I was going through some of the patient feedback, and this is an extension of that. Is most patients would rather use Secure Mail with their healthcare professionals than any other mode of communication. In many cases, not necessarily every case. There's still times where we need to have a phone call or an in-person visit, but there are most situations that can be handled through a secure message is much easier and more convenient for both parties. We've often kind of just gotten used to using the telephone for most of our interactions. And Roy kind of touched on this briefly a moment ago when we talked about how you can use email when it's convenient for you. The term that we use around the office is email is asynchronous, which means I get an email at 8 o'clock in the morning and I can respond to it at 10 or 11 or 12:30 or whatever's convenient for me. If my doctor phones me at 8 o'clock in the morning, I have to answer it at 8 o'clock in the morning. I have to synchronize my schedule so that both the doctor and I can be on the phone at the same time. I work a regular job, and so do most people. So at 8 o'clock in the morning, I'm probably on my way to work and not able to talk to my doctor. But if the email comes in, then I can respond to it when I am available to do so, which makes life a lot more easy, and I can more quickly get back and be more efficient with my time as well as my doctor's time. And maybe we'll just leave it at that and move on to the next one, Jeff. Again, these are the more of the feedback that we've had from both, well, in this case, from doctors. The first one there from Dr. Michael Giuffre, who's a cardiologist in Calgary, a pediatric cardiologist, to be clear. We invite all of our patients to use Secure Mail, and they're very respectful of physician time and availability. This is such an important point that I just really can't stress enough. Whenever we open up a new mode of communication or a new conversation with someone new, there's always that fear or that concern that someone's going to abuse it. And we have not seen that. It's surprising. Maybe I shouldn't say it's surprising, but it may be surprising to some of our new customers is that patients are very respectful of the service, and they use it in a way that's appropriate. And for the very small number, and I say vanishingly small number of patients who do send a dozen messages a day, as I was saying a moment ago, it's much easier to deal with a dozen emails than a dozen phone calls because I can handle them all much more quickly. Now, it's not a big concern anyway, but if it does happen, it's very easy to manage. And the last thing from Crowfoot Village Family Practice, again here in Calgary, where I am today, they get a lot of staff satisfaction by using Secure Mail. Because of that asynchronous nature of using Secure Mail to communicate with patients, there's less of a time pressure stress to answer. If they can reduce the number of phone calls that were coming in, I think it was 30% fewer phone calls, Rohit was saying a moment ago. It's just less intense and easier to manage your workload if you can do it at an asynchronous, at your own pace in an asynchronous fashion.
Yeah, good point, Mark. I'm just going to move on real quick so we can get to a couple questions we have. So there are other webinars coming up every Friday at noon. We are running a webinar all about some tips to how to use virtual care with Secure Mail. So we'll be doing demonstrations. You'll get an email about that tomorrow with the link to register, and it'll get you to the next 3 virtual care webinars we'll be holding. And then we have another one about keeping your clinic compliant with Secure Mail at the end of the month. You can register for that as well. Winners of the draw. So big prizes coming out for Mark K, who has the most secure messages sent in the audience today. And number 2 for most secure mail invites. So you can invite any clinic and patient. That's for Laurel S. So congratulations. And for showing up today, Patra R gets a $25 Amazon gift card as well. So thanks for that. I will say before we turn out and get to a couple of questions quickly, you can do a quick privacy assessment on our website just to kind of get a sense of where you're at from that sense. But we do have a couple of questions. How do patients get on the system? And then sort of a follow-up is, do they have to pay?
I'll take that one, Jeff. So patients are generally invited to the system by one of their medical providers. So whether it's a dentist, a doctor, a chiropractor, Secure Mail being an enclosed system, as Rohit was saying, the subscribing practice simply sends an email to that patient saying, I want to use Secure Mail with you, here's your invitation. And for patients, there's absolutely no charge. They just sign up, enter their name, create a password for the account, and then away they go. We don't ask them for a credit card or anything else that could to do with payments. So it's free, easy to sign up.
I will point out to you that the acceptance rate for invites to patients is much higher. Patients are very, very likely to accept the invite, and they're happy to use the system. And if we'll get to one last question before we go. Can patients get support? Basically, is the question. I think a lot of systems out there, you're kind of on your own, so you have to install software. So can you talk about how that works for patients and other providers?
Oh yeah, that's a very good point, Jeff. Is that, and I get this question all the time, especially when I'm onboarding or training a new staff member. Our support department is available 8 to 5, Monday to Friday. We have it open through phone, email, and live chat through our support portal, and it's available to everyone. And I always feel I'm always surprised that I have to point this out, but we provide support to every one of our users, whether they're a paying subscriber, a free user who's a first-time doctor on it for the very first time, or a patient. We accept calls from anybody who needs help with it, regardless of their status on our system. So free and paid gets help any way they might need it. And our support portal is at support.brightsquid.com, and you can contact our support team there anytime through the 3 channels that I mentioned.
That's great. Thanks, Mark.
Eight to
We're at
five,
our time.
8 to 5 Mountain Time, Mark. Just so we're clear.
That's right. I always forget that not everyone gets to live in Calgary. Thanks, Roy.
Yeah, lucky or unfortunately, so great. Thanks for tuning in, everyone. We will be sending out a recording of this presentation by tomorrow, and with the links to register for the upcoming virtual care webinars that we do on Friday. They're just 15 minutes of your time every week, but we do provide a lot of important insights. And any other questions you have, please do get in touch. So thanks for tuning in, and have a great rest of your day.
Bye, everyone.
Thanks, everyone.